What is your one piece of advice for Australians ahead of the next pandemic? And are we sufficiently prepared?
Quite frankly, we can never be sufficiently prepared for any catastrophe, I believe. We can't keep our focus on it, and we don't have the money and the time span to do it. So we are improving our capacity, I think. The new CDC will, I think, get the states working better together. If you look at the world in 1900, there were 1.6 billion people. Now there are 8 billion people. And a lot of those people are in Africa, and they're coming in contact more and more with wildlife. The food situation in Africa is getting steadily worse due to climate change and various factors like wars. So there's the danger of viruses jumping across. This is certainly the case with Ebola. We just saw a case. There's a new virus that emerged in the Congo. Appeared first in 3 children who died after eating a bat. The other thing that's happened with influenza is after the Second World War, the US and Australia particularly got together to try and improve food security in East Asia, particularly in China, and help them build massive chicken industries. And these birds are multiplying influenza viruses and getting them across into people. So there's a much greater risk from influenza. Then, of course, there are the live animal markets, and with many more people, they become more dangerous. And then above everything else, there's long-distance planes and mass international tourism. Changing human behaviour is complex. I think what governments need to do is they need to keep their public health agencies strong and on the ball. If we ever get a serious disease, COVID wasn't as serious as it could have been. But in 1918-19, with the influenza pandemic, with maybe a quarter the size of the population we've got now, 50 to 100 million people died. Now, if we get a virus like that back again, I hope we can persuade people to actually listen to public health measures, because initially that may be what we've got.